We are going to talk briefly about two cancers that are caused by HPV, vulvar and vaginal cancer. The common etiology of vulvar and vaginal cancer is one of the types of HPV, human papillomavirus. There are 20,000 cases of vulvar cancer diagnosed annually. When you look at this slide, you can see these are nasty looking lesions. It is hard to believe that a woman would not notice the lesion, but keep in mind, there are many women who never look at their genitalia or touch it other than for toileting. The picture on the left is a vulvar intraepithelial neoplasm. The picture in the middle and on the right are more advanced vulvar carcinoma lesions. The signs and symptoms of vulvar cancer include itching that doesn't resolve, bleeding that is not associated with the menstrual period, a palpable lump or color change of the skin, and tenderness. The lesions that are worrisome are ones that are ulcerative, especially if the patient has a history of genital warts or HPV. Vaginal cancers also present with bleeding out of cycle, painful intercourse, bleeding with intercourse, unusual vaginal discharge, painful or difficult urination, or difficulty passing stools. If a vaginal lesion is large enough, it may impact the anterior vaginal wall and obstruct flow of urine, causing the urine symptoms. If the lesion is on the posterior wall, it may obstruct passage of the stool. This slide shows you an example of a vaginal neoplasm. As it grows, it may slough some, and that causes the unusual vaginal discharge. The medical management of vulvar or vaginal cancer includes obtaining a biopsy to identify the lesion, followed by surgical resection. For vulvar cancer, the surgery involves a vulvectomy, which is shown in the picture to the right. You can see how disfigured this woman becomes after surgery, which is why I include the picture. It is better for you to be shocked looking at a slide than to be shocked when you see this on an actual patient. If vaginal cancer is present, the patient must have a vaginectomy. Unless she has reconstructive surgery, this woman is no longer capable of having penile vaginal intercourse. Both surgeries are followed up with directed radiation therapy. In addition to providing routine post-op care for this patient, the nurse needs to be on alert for this patient's ability to void after the Foley catheter is removed. Radiation causes scarring and is painful, so monitor the patient's bowel and bladder function. This patient needs a lot of psychological support due to body image disturbance. She will have questions in regards to her sexuality, including how does one have intercourse without a vagina, and perhaps may even question if she is still a woman. Be supportive and encourage questions. Allow this patient to discuss her concerns. If you cannot answer the questions, let the physician or NP know of the patient's concerns so all questions can be addressed.